Thank you for joining. My name is Elliot, Kohn. I oversee growth for CRC Physiatry. We're a physiatry group servicing about 700 nursing homes across 41 states. In my role, I have the privilege of having a front row seat with working with a lot of different providers across the country, truly understanding what their struggles are, what their strategy is, and how things actually implement into your daily practice. I was asked to put together a panel, and it came to mind of there's a lot of strategic insight, there's a lot of planning, there's a lot of things that get put into place, but sometimes it works and sometimes it doesn't. And what I really enjoy understanding more is working with providers and working with groups across the country to really get some key insight. And putting together the panel, the title of the panel is, strategy and execution and when it fails. And I like hearing from very different perspectives, from different areas of the space, and put together a great panel here to kind of talk about that. Right next to me on the left, we have Nathan Davis. Nathan is the founder of Worthy Insurance, which is a national insurance provider with a primary focus on healthcare, or a large focus on healthcare. Nathan also is one of the founders of MOZART Healthcare as well, where they operate facilities across the country. Nathan and I have seen each other at conferences in the past, and we actually started a conversation recently. And Nathan has a really good insight in so many different factors from the MOZART side, and then also from the insurance side. He usually is also sometimes the person that maybe gives you the news you don't want to hear, but does it with grace and has a lot of experience with multiple different things. So Nathan, thank you for joining, and if you want to introduce yourself as well.
Thank you. LEK, as I know him. As he said, my background is in the skilled nursing space. Obviously, I grew up in the business, family business, owned and operated for many, many years. Started off as an administrator, started off less than administrator, until I got my license, and then grew from there, helped grow the business. Over time, we sold. All the while, I founded Worthy Insurance about 21 years ago with my oldest and closest friend. And like Ellie said, after we sold and got out of operations, MOZART is strictly real estate, but we're dealing with different operators in different states, multiple states, and we're able to not just be a landlord that just needs to collect their rent. It's more of a landlord that understands the ins and outs of what's going on in the building, because we've been there. We operated, we know the struggles, we know the successes. And then the risk side of it is something that I think sometimes gets overlooked, and to bring that side of it and understand what's really risk and what's not really risk, it's just to really try to see a whole picture and be able to say sometimes been there, done that, or I know what you're going through, and things like that, to help the operators be successful in what they do. And stay in our lane, they can stay in their lane, but really feel what they're going through.
Thank you. It's one of the reasons why we have him here, besides his beautiful smile. And next I want to introduce Jennifer Daugherty. Jennifer is the managing partner at Serenity Estates. Serenity is a growing post-acute network in Illinois and Florida. Jen and I actually met about 6 weeks ago. We were introduced by Altea Healthcare, and we actually had a sit-down meeting at ECAP where we had a little bit of what we call a paparazzi moment. Someone snapped a picture of us, and then as we were meeting with John, her other managing partner over there, and it ended up on LinkedIn for some reason. I guess that actually formalized our meeting. We still don't do any work together yet, but there's, it's definitely, Jen has, what I was impressed with initially is her, clearly how she holds herself and how she operates and how she truly cares about what she does with her patients and her staff. And Jennifer actually, I learned, has a PhD in strategy, actually. So who better to have on a panel that has a PhD? I didn't even know they offered that, but maybe I'll go back to school and get my MBA in that. Who knows?
It's very expensive.
That doesn't surprise me at all. But really appreciate Jennifer being here. Again, she has a lot of insight and experience and can really dive into certain things. And we really appreciate you kind of making out the trip. So Jen, thank you.
Yeah, thank you so much for having me here. I'm so excited to be on this panel, and I'm a little nervous because all of you have a lot of insight, so I hope to keep up. But my name is Jennifer Daugherty. I go by Jen unless you don't like me, and then call me Jennifer. I am one of the two managing partners. I know, gosh.
Now I know.
My managing partner for Serenity Estates, my other partner's name is John Cogliani. We are both nurses. Serenity Estates is a ministry of healthcare, nurse-owned. We run daily operations for our group of homes, mostly in the Chicago region, in Florida, and Missouri here soon. We're very excited. I grew up also in the healthcare space. My mother was a nurse. She worked night shifts, and I slept in the break room. And I got to watch her push carts and just be with the residents and truly care. I saw her heart. It was full of gold and still is. And I knew that I would forever be in healthcare. So I became a nurse. I somehow ended up in nursing home operations. I love it. I love the team that I'm with. And I love that we get to be able to provide such great care to patients who put their trust in us. So thank you so much.
Thank you. We're really looking forward to this. I appreciate it. Next we have Kyle Linn. Kyle actually and I met about 2 years ago when you were first at that point serving as the COO at Brickyard. Brickyard had 20 facilities in Indiana or so. Kyle is now actually the COO for Campbell Street, where you're operating facilities in Iowa and in Minnesota. Kyle is probably one of the kindest, yeah, I can confidently say that, and most approachable senior leadership individual in the space that I know, and is very easily approachable at any conference, and that's how I think our interaction started. Kyle, obviously, again, operating in Iowa, which, as anyone here can imagine, can be a little bit of a difficult state, and the fact that he probably handles that really well. Has a lot of insight as an operator and really giving us some good information. So Kyle, appreciate you coming.
Thank you, Elliot. Certainly I want to say thank you to Thrive. It's a pleasure to be here and be a part of the conference and the show today. And also Elliot for putting this together. He's a tremendous leader in the space. And also to share the stage with these panelists because they certainly make me look pretty good being up here with this group. So as Elliot mentioned, my name is Kyle Linn. I'm the acting Chief Operating Officer at Campbell Street Senior Living. I've been with Campbell Street for about 6 months after previously serving in one of the largest operators in the state of Indiana. And Campbell Street is a very diverse organization in the respect that we serve in skilled nursing with some senior living, but also we have a capital arm of our organization as well as an ancillary arm of our organization. So very diverse, very Midwest-based, Midwest-rooted, but more than anything, we're an organization that's very culture-first, with a culture centered around our people, servanthood to all those that we have the pleasure of serving, being our employees, our residents, our families, our customers, and so on. So it's a pleasure to be here today and look forward to spending some time with all of you.
Thanks, Kyle. Actually, to note, I actually tried to get Kyle on the panel at Thrive, New Jersey, but that didn't work out for scheduling, so we're happy to have him here. Last but certainly not least, we have Rachel Sargent at the end. Rachel is the Director of Enterprise at SHIFTKEY. SHIFTKEY is a national platform that connects clinicians with operators across the country. I met Rachel actually at ECAP in Miami about 2 years ago. Sensing a little ECAP theme actually now I'm thinking about it. And you know what was, I had the opportunity over the last few years to learn a lot more about SHIFTKEY and what they do across the organizations, and working a lot with Rachel in certain aspects. What truly is amazing is that she works also directly with leadership from facilities across the country and can really give us some good insight into what facilities are doing, what operations are doing, and really how the strategy can break down. And so really appreciate you having here, Rachel, to give us more of that insight.
Yeah, thank you for having me on this panel today. It's also thank you to Thrive for having us as well. I've been with SHIFTKEY for about 7 years. When I started, there was 10 people, and now there's about 300, so it's been incredible to see the organization grow and to see us branch off into different spaces. So it's been exciting.
Thank you. So as you guys can see, when I said earlier that we have a great panel here of different opinions and different perspectives, it really gives us a good insight into what we're doing and what we're here to learn about a little bit more today. So if anyone has seen me moderate a panel previously, I usually like to start with an opening question and kind of zoom out a little bit. And I'd like to ask each of you individually, we can, we can do the answers in about 60 to 90 seconds or so, is if you can change one thing in the healthcare landscape today. That can be incentives, that can be operational structures, that can be anything you can think of that isn't necessarily possible, but it's something that would make a big difference. And that being said as well, if you can give some insight into what you or your organization are doing about that, even if it may seem not possible. Go ahead, Nathan.
Loaded question. I think that there's so many things I would
You didn't
want
think
to
this
do.
was going to be easy, did you?
No, I
Okay.
did not.
Just making sure.
I think when I told you earlier, I don't need to hear the questions before. Just I'll wing it. I'm winging it. The first thing that comes to mind is if there was be a way that we could actually put a value on people. And what I mean to say is that sometimes you have underwriting and people looking at something and the numbers just don't make sense. But the people behind the plan make sense. And it's a dream, but can you imagine if a bank actually had a line item where they would put a value on a deal because they know the person running it and they can actually make it work within their box, within their lending parameters and things like that. But the same thing goes with running a business. There's just the value. You have to be able to see the value in people and know how to capitalize on that. So it's obviously I like to say I like to invest in people. If we can capitalize on that, that would be an amazing thing, I think, across the board. I think from a risk perspective also, talk about insurance. It might be really risky, but you got someone watching the store, someone that you can count on or things like that you can say like, okay, we can bring down the risk level a little bit just because of the person, just because of the team, just because of the people, just because of the attitude. It would be an amazing thing if we could actually do that, so.
I love that you said that because I don't know if, again, at the Thrive panel in New Jersey, Austin Steele, who presented earlier, is he still here? No, anyways. But he also said that there's no line item for culture. There's no ROI for culture because it's one of the most important factors, but again, there's no way to actually put a tangible item. So I appreciate that. That's fantastic. Jennifer, go ahead. Sorry, Jen. I still like you.
Thank you. I appreciate that. I was a little worried.
Yeah. Sorry.
So I would change who actually has that decision-making authority over patient care. And if you think about it right now, it's probably the payer mix. And it's not the clinician or the physician. And we've normalized this, where we all understand that the payer mix is possibly, most likely, going to override the physician orders or the clinical suggestions. And that should bother us a lot more than it actually does. And it's not just a policy problem, it's a data problem. We're looking at insurers, health insurers, that use population levels instead of individualized care needs, where medically necessary gets defined as like by a spreadsheet and not by the actual person. This leads, of course, to delayed care, higher acuity. If a patient needs to move on to a lower level of care and they're unable to because of a prior authorization wait, they might get sicker. And then possibly that care costs even more than it did in the beginning. And with the exact same payer who will have to pay that just because they were trying to switch the risk around a little bit. We don't connect those dots until probably months later, and a patient might even give up and go home. And of course, what we do is look at our infrastructure for prior authorizations and reduce friction and lags as much as we can with insurance organizations. We're very intentional about our contracts nowadays. We're looking at value-based arrangements and shifting back to allowing the care teams to make that decision for patient care. So we're currently trying to put that back in the care team's hand for patient care.
Well, I think you're preaching to every operator here, and you're right. It is definitely something that, it's a battle we face every day. But, definitely, and I guess throughout the sessions as well, we'll kind of dig deeper into that strategy and what that looks like and giving back. So thank you. That's
Of course, thank you.
helpful. Kyle.
Thanks, Elliot. Yeah, I guess if I could change one thing, I would probably, it'd be giving administrators and DONs a frequent flyer miles program for as much as they run throughout the day. Whether that's running from meeting to meeting or a last minute compliance issue or whatever else comes up throughout their day. So all joking aside, as a senior servant leader for an organization, I constantly keep myself in the shoes of our building leaders. And someone who started and grew up as an administrator, it's always been something that's very important to me. So I'm sure any one of us could sit up here and talk about whether it's improved reimbursement or less regulatory pressure, improved workforce, et cetera. But I think what I would say probably, and we didn't plan it this way, but I'd say it's a little bit of a blend between Nathan and Jen here, is I think I would challenge to realign incentives around long-term resident outcomes and workforce stability. In our business, similar to what we've talked about here today, in a silly analogy, where the cheese is constantly moving and we're constantly chasing the cheese. And whether that's documentation compliance, whether that's volume, whether that's short-term initiatives, but we think about all these type things that become competing priorities. And as you just mentioned and mentioned well, things like culture and what it takes to drive a successful business in this space is not recognized. It's not recognized in the value-based structure and those type things. So, at the end of the day, I still believe being successful in this business is if employee retention is strong as a result of employee satisfaction, and if you're driving quality outcomes, including your traffic to and from the hospital, I think you can succeed in almost any model. So for me, I would challenge realigning the incentive structure and challenging the model of that system around long-term resident outcomes, quality of care, and workforce stability.
Wow. Okay, I couldn't have set this up better because that's, again, it's also the key focus. Probably the most, the highest expense of an operator is your workforce. So like I said, I couldn't have set this up better, but Rachel, would love to hear your answer.
Elliot, I can see why you put this panel together. Yeah, my answer was very similar to Kyle's. I would choose to move to a value-based incentive structure as well. I think a lot of the times it's easy to get caught up in processes and cost, and instead of remembering the human element. And I think that that's something that we need to always remember to focus on, and because it's the biggest part of what we do every single day is patient care. So I think at SHIFTKEY, we work to connect operators to independent, skilled professionals through our platform so they can find that stability, whatever that looks like, within their care teams themselves.
Wow, okay, fantastic. That was really helpful. You want to say something? Yeah. Oh, okay. I did tell you you could at any point, by the way, just go for it.
I'll cut you off when I'm ready.
Perfect. Well, let's dig a little bit deeper and how strategy actually affects and translates into an organization, what that looks like. So the first kind of thing I want to talk about is strategy versus execution, right? We can have wonderful plans, but if you don't execute, it's worth nothing. So Kyle, from an operator's perspective, where do you most often see the gap between strategy and execution? And where do those show up?
Yeah, that's a great question, Elliot, because I think at times in our industry, I don't think we're short on strategy. I don't think we're short on strategic planning or how to improve the business. But in answering your question, there's really two things that come to my mind. One is buy-in and creating buy-in with facility leaders who are ultimately the ones that are going to drive the change that we all want to see. And the second thing is, I would say, kind of the middle decision-making layer. I think sometimes one of the trap we fall into as senior leaders of an organization is we discuss strategy, set the strategic planning, and then we expect just to cascade that down. And sometimes we can miss the middle layer, who, in my mind, are regional directors of operation, our regional directors of clinical services, they are like for lack of a better way of putting it, they're like the asset managers for their buildings that they serve. And so I think creating buy-in is something that it can be overlooked because of how quickly we move, how quickly we shift and pivot. But ultimately, we can be setting the strategic direction, but if we don't have buy-in from the facility leaders, then there's going to consistently be a gap there with execution. So inviting them into that process, making them a part of that process, because the unfortunate reality is we have to continue to manage bandwidth and time. We talk about strategy and things that are important, but there's very real day-to-day issues that create competing priorities. And I think that's important to continue to recognize as we, from an operator's perspective, as we serve and support our centers, is with all the competing priorities, they're dealing with very real things that I may not be. The call off that just came in unexpected a half hour before shift, or the nurse manager that just quit without notice, or we have 3 admissions coming today and I've got someone that's going through a change in condition. All of these things that are very real time and bandwidth constraints for them that can create, I believe, some challenges in that gap between strategy and execution.
I mean, I keep saying this, but I don't think I could have set this up any better. Kyle, that was, I mean, really, thoughtful answer, and it definitely gives some insight. And I wanted to actually kick it off to Rachel, as I said, couldn't have set this up better. But being that you work a lot with operators all across the country, you probably have also a key insight and perspective, seeing how some of these conversations break down. And like as Kyle just mentioned about, especially workforce, right? Those are really where breakdown happens. So I was curious to get your perspective on when you see those break down, how do you see them break down, and what do they actually look like? And what do you do from your role and from your position to kind of support that?
Yeah, I definitely think, leaders have to, again, be in sync with day-to-day operations. When they're creating strategies that don't involve the real-life scenarios that are going on, that's usually when I see things fail. And so there needs to be a leader of that strategy, and there needs to be somebody responsible for the outcome, working with the team, making sure that if something's broken, they're jumping in to figure out how to solve it. I kind of compare it to, let's say you roll out a new payroll software, and you're expecting it to approve inefficiencies. However, your staff isn't that engaged, they don't use it correctly, and then as a leader, you get that data and it's not favorable, and you think, oh, well, my new payroll system doesn't work, right? When in reality, if people had more training, if you contacted the vendor, you changed settings, whatever the scenarios may be, a little bit more focus on that and someone owning that strategy could help that outcome be better.
Totally hear that. What are some of the, follow-up on that actually, if you don't mind, what are some of the earliest signals when you're working with some of these groups that breakdown is starting to happen? Is that communication? Is that, misalignment? Where do you, because I'm sure you see it all the time, but what are some of those signals that you, from your role, that you're able to identify and I've had experience with watching?
Yeah, I think it's obviously different for everybody, but some of those signals are, you have frustrated teams on the ground who have a uniform policy that they're supposed to be abiding by, but maybe it doesn't work quite well for them in the unique situations that they're dealing with at their buildings, right? And they're not getting a lot of communication from that. Usually you see people just stressed, right? And they're not connected and in sync as a team.
Thank you. Yeah, it definitely, it can be overwhelming from a facility level to the regional levels, and as it continues to grow up, and that's kind of where you see it. Go ahead, Jen.
So I think the common theme that I'm hearing from the two of you is that the strategy's there, but the execution is inconsistent, and that's possibly that the specifics aren't there. You're saying that someone needs to take control of it, and you're saying very similar thoughts as well, and I believe that the strategy plans are there. I believe that they are not very specific. They're not time controlled at all in all organizations. In giving that to someone, assigning it to someone, assigning a time frame, that definitely drives the strategy along. And we need that in all strategy plans, or if not, then we're just putting Post-it notes on the wall and we are hoping for the best, and that cannot be our strategy.
I would add, all 100 really great points, but sometimes the best execution is to execute the strategy that you thought was good. And some people, I think people are afraid to make that move quick enough, because it's hard. You put your heart and soul. You talk about putting in a new system. You invest in a new system, you pull it out, you make the printout, and you think you have the buy-in, but you don't have the buy-in. And then you realize that this building, this area, this region might not be cut out for it, and maybe what you thought you were getting wasn't exactly what you were getting, and you're looking at a new deal, and you think this is your strategy of this building, and you get in there with this whole plan, and you work it. You got to know when to say, I got to pivot. I got to relook at my strategy, and I think sometimes people don't look at. It's hard, very hard. You make a call on spending hundreds of thousands of dollars on a new software. What if it was the bad move, and you shouldn't have gone with that software? And it's very tough to make that decision, but sometimes the tough decision today will help you get somewhere in the long run.
I think you said two interesting things. Number one was sometimes you just need to do the strategy. You just have to execute that strategy. And the second thing is you have to know when to pivot.
Yeah.
And that's exactly right. You need to know when whatever strategy you have is actually not working out because it was poorly executed or maybe not specific enough, or that you have external variables that are not aligning, that are no longer working with your strategy.
Well, so now actually, and I'm curious, Nathan, do you have any examples, real world examples over your experience where you had to cut your losses and pivot? It might have been painful, but
One that I sort of alluded to was, this is early on in the days of EMR, before there was, I think PCC was brand spanking new. And there was a couple of other companies that were out there beforehand, and we were, in my family's business, my father started in the business in the late 60s, I think. And there was early on EMR, very, very archaic EMR in those days. And then that company that he was with, they sort of tried to get into the 21st century, and PCC was coming out of the woodworks, and there was another one, I can't remember the name of it. And I remember we had meetings after meetings, and we were back and forth. Which one should we go to? Should we go with PCC? Should we, there were a couple people going with that, but not everybody. People were crying over some of the pains in the early PCC days. And we made a choice. This is years ago. I don't remember what we picked. We did not go with PCC. Shocker, right? Heads exploded everywhere. We went with another one, and I remember having the conversation about 2 years in. We're hundreds of thousands of dollars into new computers, new clouds, and new servers, and trainings, and train the trainer, and train the trainer's trainer, and all this stuff going on. And it's a tough to say, you know what? Maybe we should have gone with PCC, or maybe we should have gone with X. And we got to relook at this. It's just not taking off the way we want it to take off in any region. And all the steps were there and everything. It just wasn't getting that traction that we wanted. But it's tough. You invested so much money. You got to know when to cut your losses and say, okay, I gotta rethink this.
That's, again, a great point. I'm curious actually to add to that, just a quick follow-up. Do you think some of those decisions or failure to pivot quickly have to do with, I'm trying to think of the PC word to say this, but ego?
I would say ego, and then something that, I don't know who mentioned it, but having the right people in on the strategic planning. Sometimes you think you have everybody around the table that you need to have to make this decision, but maybe you need to have 3 nurses and 2 CNAs at every single one of those meetings when you're making a decision, because they're the ones that are going to touch this the most. Your regional nurse might be great, and your director of nursing, your best director of nursing might be great. Maybe even getting more of the team. I don't know. That could be. So is that called ego, or is that called not involving? It could be a little bit of a hybrid, but definitely, sometimes you got to be able to hear and see from other people's perspective.
Kyle, go ahead.
No, I think one thing Nathan said, that when I think about pivoting and times where we've had to make operational decisions to pivot and they were successful, Really, there's two very simple things that come into my head when I think of those experiences. And one is explaining the why, and two is being very transparent. And being transparent, like rooted in the data of it, of not just saying this isn't working, but this isn't working, and let me show you what we're looking at here. And so I have found with making difficult decisions and knowing like when to pivot in order to create that buy-in and ensure that we're managing the risk of further pain, I consistently come back to those two simple practices of explaining the why and being transparent, rooted in the data of why we need to do something. And with those, oftentimes I find that people are more on board. They embrace and understand it may be painful. There may be challenges that we have to overcome, but ultimately they're on board.
I said he's one of the kindest operators I know, that you can see that you lead with a certain demeanor by including your team and actually taking insight. One of the other panelists we did in the past to one of the, I think it was Ron from HMG, and his comment was, just listen to your people. Just listen, hear them. Sometimes you don't have to react or respond on everything that they say, if some of it might be inaccurate, but all in all, it's still, listen, and that's, get their insight as well, and kind of get an ego check almost a little bit, like kind of get that into perspective, so thank you. Let's talk about alignment. So Jen, from a leadership perspective, how do organizations successfully translate strategic vision into consistent execution? And that definitely becomes, especially when you're operating in multiple states, a lot of times when you have to execute across different teams, what does that look like for you?
So I think first and foremost is that we have to understand that alignment does not equal agreement. I've been in several rooms where I've got several nodding heads, and we walk out and we are not aligned. But we all looked like we agreed in that meeting. Real alignment is when we can disagree in the room, and we can walk out with the shared vision still and the shared specific plan of what exactly we're going to do and when are we going to do it. Misalignment shows up in any resource allocation. So at the end of the day, when I ask someone to move a budget or to give a head count to someone else and there's any pushback there, then I can see that we are misaligned on whatever it is that we're trying to be successful for. And I do see this in middle management like as the broken link. So at the executive level, we are trying to discuss a plan or a strategy, and a middle management might shake their head at me. They leave, and we all think that we're on good terms, but then they disagree with it. I see it there. I generally see it in the head count or the budget when they do not want to give up that individual or change their head count. So from an operational discipline, we look at not just creating a cultural aspiration, we're looking at alignment checkpoints in all of our meetings. We're looking at decision logs, like are all of our choices that we're making, are they consistent across the board in our shared strategies? And our leaders are accountable for how well their teams are also prioritizing or reflecting in the organization as our priorities.
Couldn't agree more.
Great, thank you.
Kyle, when alignment is working well inside an organization, what does that actually look like from the facility level? Because I know you specifically are very, very hands-on, even in your role. I think every time I've been speaking to you, you're en route in Iowa, just driving from building to building. So curious what that actually looks like from a facility level when it actually aligns.
Yeah, great question. And I love what Jen said. I'm always searching for nuggets, and I thought one of her opening lines of alignment doesn't necessarily always mean agreement. I just think that's a really powerful takeaway. And so, when you ask that question, Elliot, I think what I would say first is it's not necessarily just how it looks. You can feel it. As an operator, and I know that sounds like gut, it sounds subjective, it certainly doesn't mean that I'm the best at it or I'm always right or wrong, but I can walk in a center and feel whether they are aligned and aligned with strategic priorities pretty quickly.
Actually, I was hoping you would answer that. That was what I was like.
So I would say it's a feeling first, but specifically, like, what does that look like? I think you can see it in pretty concrete ways that sometimes can be very simple. You can see a daily morning stand-up meeting, which is like the the conventional wisdom of our business, right, that has stood the test of time is the importance of daily stand-up meetings that you can see very quickly in a stand-up meeting whether there is alignment and where that team is going based on how that meeting is run, the environment of it, et cetera. You can see it between the like trying to align priorities with the connection of bigger goals. You can see and feel those gaps within a building. And so I think with that, you oftentimes can see it where culture is constant and firefighting is low in those type centers. And that doesn't mean that fires don't exist. It just means that they have the flywheel turning and they are aligned and they know how to manage through those things. Oftentimes when a building is firefighting and those this type language comes forward of it's just we can't get to this strategy because we're focusing on this, or I had X come up yesterday. Oftentimes that's an alignment gap, and I think many do not see it, and that they're too close to the trees to see the forest, that it's an issue around alignment. So just a few examples I would give there of how you can see it, but I think oftentimes it's a feeling first that you can feel as an operator and in your gut, whether a building is ultimately aligned and moving in the right direction.
And is that, at that point, let's say, for example, you're walking into a facility and there's that feeling that just something feels a little off. What do you do at that point? Where do you start asking those questions? Do you because a lot of times things have to be dealt with sensitivity. So I'm curious, like when you walk into a facility, just off, like how do you start, or what do you do at that point?
Yeah, another great question. I think every situation and scenario can be different, but I think the phrase that I would use is oftentimes one of the most important roles that I play as a senior servant leader as an organization is being a coach. And so the silly phrase I would use is there's a difference between coaching and corporate at that point. And I think most of you in the audience know what I mean by that. And so I'm in coaching mode at that point where I'm asking questions, I'm letting them guide and get to the answers and trying to help them understand the why, how we're committed to this together. And it's not coming from a place of corporate or a directive or you're not doing well in this, et cetera. So I'm not saying managing feelings, but I think it's important in those moments to put your coaching cap on in order to try to help them see the forest and then move properly in that direction.
Well, thank you. I think we're getting a lot of takeaway lines here. This is great. Appreciate that. I wanted to talk about partnerships. I wanted to shift slightly and talk a little bit about role partnerships and how they can play in supporting or complicating strategy within organizations. Rachel, from your experience working alongside operators, how does external partnerships reinforce strategy or sometimes does it fragment it?
Yeah, I think partnerships are what you make of them, right? I think it's easy to approach partnerships with an understanding of their services very well. But what I find is the more open you are, the more communication you have, the more vulnerable you are to sharing some of the struggles that you have, the more willing and able a partner is to be able to help you solve those. And sometimes you don't know what resources they may have available to them that they can give you to help, right? And so that's what I see is open, honest partnerships.
And I would imagine a follow-up to that is I'm sure you see some hesitation in your line of work with operators. What are some of those examples of how you build trust at that point? Because a lot of times there's a lot of pushback, like we were talking about throughout this entire conversation so far, is again, strategy starts at the top, but it's how it breaks down. And I'd imagine, especially in our line of work, well, in physiatry as well, we have buy-in from leadership, and they pass it down, and then all of a sudden they're like, wait, we don't want this, we don't need this, like, we're good, thank you, after conversations have already been had and contracts have been signed and so on and so forth. So I'd imagine from your role at SHIFTKEY as well, I would imagine you're probably met with some hesitation. What do you do in that circumstance from your perspective, and how to build trust and actually get buy-in?
Yeah, I think everyone has a different, unique approach to workforce strategy. And so what we try and do is ask a lot of questions and get information so we can understand the correct tools to present and to show people who are using our platform. And so that also comes along with a lot of data. We have reporting tools and all sorts of information we can give them to help leaders make informed decisions themselves instead of us trying to say we know exactly the best way for you.
Yeah, I mean, that definitely, it makes better sense that way. Go ahead, Kyle, sorry.
Elliot, one thing I would add to Rachel's point is when we talk about strategic planning, strategic goals, strategy in general, as an operator, more times than not, we're inviting somebody into that process with us. Rarely is it an initiative that's just carried out internally within the organization. And so partnerships on the vendor side are extremely important. And when we're working with partners where that strategy becomes shared and it becomes something consistently reviewed, where ultimately that's when our success becomes their success, and that's where the strength of partnership really reaches nearly an untouchable level. And I oftentimes describe that it's about like earning and re-earning that business, and it's not like holding something over somebody's head, but that's how you re-earn that business. It's the same thing that I and we have to do day in and day out with re-recruiting employees. Just because they come and choose to work for us doesn't mean they're committed to us. No. And somebody's always chasing them. So we have to win them over day in and day out, week in and week out. And I see the same thing with the value on the vendor and provider side of strategic partnerships.
Totally, yeah, Jennifer, I'm curious. I was going to say, no, I was, where do you, from kind of an operator leadership perspective, where do you actually see, when do you actually decide if a partnership actually fits your strategy or not from a vendor perspective? I know we don't yet because you don't use us, but that's fine. I'm just curious from the other side. Twice.
So I look at two things, core competency and time horizon. We need to make sure that we are able to have the infrastructure and the know-how, or we're going to have to find a partner to do that. And do we have the time to do it, right? So if we do not have the core competency to run like physiatry, for instance, we need a physiatry partner because we aren't the subject matter experts.
Not me, but you need one, yeah.
Maybe here soon. So I need to take a look at do I have the core competency, do I have the time horizon, or do I need to find a partner who does align with me, who can win my business and win my trust and work alongside me. However, on that same piece is me as a person, Serenity States, we don't like to farm every service that we have out. We have a lot of internal processes. All of our staffing, we use staffing agency as we need to, but we definitely try to keep everything in-house because we want to have that care and that culture of Serenity staffing. So we look at, do we have the ability to do it in-house and the time? Are we going to do it correctly? And if not, then we need a partner who aligns with us well, such as a physiatry group, or maybe a great back office like Ensemble. So thank you, Jeremy, for being in here. Or any other, maybe a doctor-physician group, correct? So we just have to make sure that the partner makes sense, or you are going to farm out every service that you have. And then you're going to wonder, when you farm out your core competencies and what makes your organization, then you're going to wonder why all of a sudden your company feels off-brand. It's because it is. It's no longer you.
I think partnerships, Kyle said, your success is their success and vice versa. I think it's like one of the things I like to talk about when I talk about like MOZART to our operators is we want to put an operator in a position to be successful because their success is our success. We want them to make as much money as they can, give as best care as they can, and everything like that, because the better they do, the better we do, just as a real estate owner. But then when you talk about the vendors, a lot of times you said the vendors come at the top, contracts have been signed, here's your new vendor. And then like in the building, it's like, 1 second, are we keeping our eye on the prize? Our eye on the prize is our residents, what we're doing here day to day. This is I'm glad you love this vendor that does X, Y, and Z, and maybe even the top owner has some sort of partnership in there, so they're like pushing.
They do that? I didn't know that.
There's a name. There's a two-letter word for it. I can't remember what it is right now. I'm not going to mention it in the room. But like you talk about there's a lot of that going on. But then you have to remember this world that we live in of, I'll say it, JVs. There's a reason why that guy does what he does, like Jennifer said, and there's a reason why you do what you do. Maybe I can't be the best physiatrist. Maybe I won't be able to. And maybe
everyone's picking on me.
I won't, or maybe I won't be the best the vendor, and so you might be the right partner for me. But just because it was pushed down from the top doesn't make you the best vendor. And the way it was pushed down, and then there's other times where everybody's like, "Well, I'll let you be." It goes the other way also. Sometimes from the operations, they come to the vendors. They, "Well, we'll let you be the vendor if we can get in with you." I'm like, "Well, do you want to run nursing homes, or do you want to do what I'm doing? And then if you're just my partner, then I'm not going to give you I'm good at what I do because I give all my clients, whatever service I'm providing, I give all my clients the full attention. When you're no longer my client and now you're my partner, sometimes they're like, well, just take care of you. You're on autopilot."
It's like what Kyle said earlier, and I say this all the time. It's, you constantly have to earn the business, even if you're a financial partner in a certain way. And also, I guess, from our point of view as well, obviously there's a lot of operators that have those two-letter words with different organizations, and you you can provide better service sometimes than who they're using, but a lot of times it's dead end. And actually, quickly, Rachel, I'm curious, obviously, again, I would imagine you run into those aspects as well. At what point do you, from your experience, have you kind of, okay, it's just not worth the time anymore, even though you can do better for their patients, you can do better than certain aspects, but at what point do you, like we even said before, kind of call it quits, cut your losses? But
I think that's something that they have to figure out, right? We're always going to be honest and transparent and give you the best that we can and all the resources possible, right? But again, that just goes down to them having to make that decision, right? If you tell me you want X, Y, and Z pricing, right, and it's just physically not possible, I'll be honest with you about that, right? And that's your decision, your call. I'm not the operator.
Yeah, I mean, that's a great point. I like to say as well, I'd rather a no than a maybe, so just tell me no, that I won't waste my time anymore. But I think a lot of that sometimes it's just not the right place or right time as it is. But you're right, I think that is the key, like you were saying, Rachel, is just being honest and direct.
I think we also look for partners that we can learn something from, right? So we want to know what your knowledge base is. We would like to share ours as well. We like to talk to other operators and to know what their struggles are, what their successes are, because maybe that's something that we need to adopt and change in our own organization or culture. And we like learning that from our partners and vendors as well.
Love that. I think we got the 5-minute warning 5 minutes ago, but I think we're gonna do one more question. If you want to leave, you're more than welcome to. But I'm enjoying this conversation. We talked a little bit before about pivoting, and I want to kind of end the last question with consistency versus pivoting. And Rachel, from what you see working with operators day to day, what tends to help organizations successfully make these adjustments when they realize that something needs to change?
Yeah, again, I'll drive it back to data-driven approaches, right? And remembering the human element. If you are using both of those elements to make your decision and you're getting real information from care teams on the ground and that's being successfully shared up to the leadership level, then you can make those decisions properly. But if you have a leader who is just making a decision that they think is best and that doesn't work out for people on the ground, then obviously it's going to fail.
It just spins in a circle. But yeah, Nathan, also, I guess, from your point of view.
Yeah, I think besides data, human, I think a lot of times people get caught up. I got caught up, maybe too rough of a word, in talk about from the insurance thing. People look at they go right to the bottom line. What's it costing me? But what are you doing here? Why do you have insurance? What's the risk? Where is the risk? what can you do to bring that number down? Who's your partner in that? Who's your carrier? What type of risk management are you getting? What type of risk management are you going to put into place? There's so many things in between the proposal and the bottom line that need to be analyzed, and that goes with anything. I'm just speaking from like insurance, but with any type of partnership, vendor, any type of thing you're putting in, if you're just looking at a number at the bottom with not understanding what drove that number or what you can do to drive that number and figure that out, human data, things like that, if you're not really getting into it and understanding it, then you're not making an educated decision.
I would like to add, and that sounds great. When you're looking at your strategy, we talked about this a little bit earlier, you talked about pivoting. You need to run your strategy through the external variable test and the internal variable test. You need to make sure before you pivot, because you might need to pivot, right? You need to decide if you need to stay the course with your strategy.
Well, they really shut us down.
Oh, dang. Or if you need to change. And so when you look at your strategy and take a look to see if you're not seeing what you want to see because the external assumptions that you made have changed, or your internal execution is incorrect or inappropriate. So such as, quick example is census. If your census is not where it needs to be, your assumption is that a hospital has the volume to send you referrals. That could or could not be correct. You're also assuming that your intake individual is answering those referrals quickly. So you need to first check to make sure if the hospital does have the volume, and if it does, then you stay the course. But perhaps or you would change your strategy there. The second piece of that is you're assuming that your individual who's reviewing the referrals is doing it quickly. Perhaps they're not. That is something that you would need to change, or you would need to stay the course with your strategy, but you would need to change the execution because they are not executing your strategy. You're pivoting because you're seeing an outcome, but the outcome's going to lag from the execution. But you do need to make sure that your strategy is run past that external and internal variable test before you do pivot.
That is, valid, 100%. So I'm going to end with one last question, and we'll give each of you 30 seconds to answer it. As we wrap up, I'd love to ask each of you for one leadership lesson you've learned about aligning strategy with execution. Go ahead, Nathan.
Aligning strategy with execution. I think what I've seen is that getting your people in a building, we're talking about operations, if every person, you talk about the stand-up morning meeting, which has stood the test of time, does every person in that meeting understand how they affect the bottom line from a business? We're running a business, right? We're not doing this, there are people that do it out of the goodness of their heart, and they're not looking to make a dollar, but everybody's there for a paycheck, for someone who's making the bottom line, and quality patient care, real care. You're caring for someone's mother, father, brother, sister. Does everybody in that room understand how every single one affects that? Not just the nurse, not just the administrator. Does every person in that room and all their staff under them understand how they really, really have an effect? The simplest, and I'm not picking on them, but just the housekeeper for the lobby. Let's say you have just a housekeeper. All that person does is make sure the lobby's clean. But that person is affecting your bottom line. They're the first impression when you walk into a building is how does the lobby look and smell and present? Are you going to get another referral from it? Is a doctor going to come work for you? Is a family member going to pull their family member who's been there for 5 years out because they had a bad experience walking in the door? Everything else can be great. They're getting their meds, they're doing that. But that one thing, so just everybody, if you can get that message across, I think that
it makes a difference.
About alignment.
Yeah. Jennifer, what about you? Any lessons you've learned?
Am I creating the environment in which we can create a creative strategy and then precise execution? That's it.
It's easier said than done, but look, you clearly are doing it. So it's not just a talk. So I appreciate that insight. Kyle, what are you learning?
Yeah, I really struggled with thinking about this one when you asked the question, and I think the one lesson that I would highlight is, and I'll elaborate very briefly, is keeping things simple. Less is more, and when everything is a priority, then nothing is a priority. And so I think just part of combining strategy and execution is making sure that that is very simple and clear to those that are responsible for it.
You know, I don't know if anyone else was keeping track like I was, but I think every time I asked Kyle a question, you said, that's a good question. This time you didn't, because like you said, you struggled with it a little bit. So I appreciate that. I thought it was a good question, but thank you. No, but you're right. It really is, you know, keep it simple. What is it? Keep it simple, stupid. But, you know, we don't say that to our staff, but you're right. That can really make the big difference when you keep it simple. And again, last but certainly not least, Rachel.
I'll keep mine short, but understand before you act and be curious. You can have somebody who tells you that something is happening in your buildings and it's going exactly that way, right? But until you are curious and you figure that out for yourself, you don't know, right? And you want to make sure that you have that information before you make a decision.
Yeah, that's powerful. I think, you know, I hope, from my experience, not every operator is curious. And I think it's also not even just from a nursing home perspective, but I think in general, I think people, us as human beings, should be curious, learning and growing consistently. But thank you. I mean, I'm not here to preach on that, but I really appreciate that. Something you want to add? Oh.
Just want to say thank you.
Well, thank you
for having
again.
me.
We clearly don't have time for questions, but if you wanted to ask any of the panelists any questions afterwards, thank you for coming. Thank you for being here. Thank you for staying a little bit later. And again, thank you to each of you. You've all added a really unique insight into things. I told all the panelists also before oh wow, this is like the Oscar music. Most panels, sometimes people walk away with no tangible insight or information, and usually panels are just people are here to talk about how amazing they are. I've done talking about how amazing I am, but also each of them here have really added insight that I think each of us can take away from. So thank you again. Appreciate it.
Thank you, Elliot.